I heard someone recently talk about the role that doctors play in the lives of patients beyond making diagnoses, treating illnesses, and I just wanted to touch on it as well, because I sat and I thought about it and I realized how much we play in the lives of our patients. Now, I think it's not only doctors, everybody that works in the healthcare system. It's such a great honor and a privilege to actually be so involved in the lives of people. And when I say so involved, I don't mean you are personally involved in the lives of your patients also. I mean that it is a privilege, for you to be able to hear secrets of people, things they cannot tell other people, even their family members, even the closest person to them. You get to hear it for one reason or the other, either because it helps in treatment, yes, so it helps in their care, so they are able to open up to you about it. And then also for some, it's also a way of release, because sometimes people want to talk about their problems, but then they don't know who to trust. But then you as the doctor has been saddled with confidentiality as part of your let's say part of the tenets or the principles guiding our practice is confidentiality. Also, one of the privileges is working with people through uncertainties, because sometimes you make diagnosis of terminal illnesses, of illnesses that do not necessarily have a cure, but you are only going to manage and give palliative care until the patient passes. And so they are dealing with a lot of uncertainties, both for the patient and for the patient's family. So you also have the privilege of walking them through those difficult moments. Like, I can count a lot of things, but one thing for me that I count as a privilege personally is the opportunity of being at the end of life with a patient. Now they are at the tail end of their lives. That's for patients maybe with terminal illnesses that we are just managing, we are just giving palliative care, that eventually we know they are going to pass. So you also have to find ways to communicate to them that where they are at this point now are difficult moments in their lives. And then for even they knowing that they are at difficult moments in their life, you also have to find ways to be able to talk with them so that they feel comfortable. You make them comfortable. Basically, that's what palliative care does to ease pain, make people comfortable even as they transit to the great beyond. And for you as a Christian, it's an opportunity to be able to even preach the gospel, basically, to be able to help somebody even as they transit this world, that they are not uncertain about their afterlife. They know where they are going to based on what you are giving to them and then what they are receiving. That's basically Jesus Christ, I mean. So really, I count it a great privilege doing this job, because I get to touch lives in ways that are beyond diagnosis, beyond physical care. You go as far as giving even spiritual care. You go as far as helping with mental health and a lot of things. And I believe and I hope that other healthcare professionals count it as a privilege, because if you do, I think it also shapes the way you take your job. It also shapes the way you treat and interact with your patients, knowing that it is beyond, they always say medicine is a calling. So knowing that it's just beyond treating illnesses, but also treating a whole individual.